Coming to you from the Freedom Federal Credit Union Studios, Harford County Living presents Conversations with Rich Bennett.
Slow pitch transfer.
It's probably the least sexy part of the work, and I don't. It's okay. No. The truth is.
So what if everything you've been told about health was incomplete? Not just how to feel better, but why so many of us are stuck managing symptoms instead of building real, lasting wellness. Today's guest, Dr. Rochelin Herold, believes most people were never taught how to truly live well, physically, mentally, or even generationally. From growing up in Brooklyn in a Haitian household rooted in faith and resilience, to serving communities here in Maryland, and even providing care in Haiti after a devastating earthquake, his work is about more than treatment. It's about responsibility, courage, and legacy. And in his book, Dare to Live Well, he challenges us to stop outsourcing our health and start owning it. Did you hear that? Start owning it. So this conversation might just change how you think about your body, your family, and your future. So first of all right, do you go by Dr. Herold, Dr. Rochelin, Raj? What do you like to be not late for dinner?
You know what? Dr. Raj is common. Most of my patients call me doctor. It's funny because most of the patients in the office, I'm Dr. Herold. Outside of the office, it's usually Dr. Raj. Most people know me on a personal basis because, as you'll be able to tell, and as your audience will be able to tell, I'm very personable. So Dr. Raj is fine.
Okay. All right. So before we get into the book, before you became Dr. Raj, before the degrees and the practice, who were you growing up in Brooklyn, and how did your family shape the way you see health and responsibility today?
Man, well, I mean, that's a great question. First of all, thank you so much for allowing me some space on Conversations with the one and only Rich Bennett. I wouldn't want to be anywhere else on a snow day today.
Yeah, those of you listening, we still have about a foot of snow outside.
Exactly. So no, you know what? Growing up in Brooklyn, man, I came from two great hardworking parents. They were actually business owners. They owned a travel agency that maybe had like about 4 to 5 locations at one point.
Oh, wow.
My father, I used to travel with him to like JFK, LaGuardia. He was almost, had it not been for all the crazy political things going on at the time, he was on track to creating his own airline. He was already chartering flights going back and forth to Haiti and other destinations in the Caribbean.
Wow.
So just like there was like an Air Jamaica at one point, once, we were doing pretty good, but everything happened back in the 90s and the business fell apart, whole family. But what happened was that while I was growing up, what I learned from my mom and my dad was just real good, hardworking values, right? Mm-hmm. Learning that, you got to get up early and go to work. You got to give it your best no matter what you do, whether I was sweeping the sidewalk, whether I was, cleaning in front, like if it was a snow day, I was trying to instill that same thing with my son. Like whatever you're going to do, make sure you do it to the best of your ability, right?
Right.
Sometimes you only got one shot. So I've kind of taken that, value of hard work and I put it in healthcare. I put it in everything that I do. Also, it was just more of a natural, like a lot of times we weren't always like running to the hospital for every little sickness and all of that stuff. They were used to, help you get better with just more natural substances, herbs and things of that nature. But unfortunately, I was still the sickest out of all my family. I was the sickest, right? If there was a medicine cabinet in the house. Yeah. If there was a medicine cabinet in the house, I would probably have 80% of what was in there. So, I always had this respect for medicine, but this disdain because they didn't have all this bubblegum flavor and cherry. And, I'd have asthma. I would have allergies. I would have all these things going on. And just having to take, medicine that just did not sit well with me. I always liked healthcare. I know in the 7th grade, I learned the body and I just was intrigued about how the muscles worked and how the bones were organized, how we were just, intricate, fearfully, wonderfully made, right? And then from there, I just kind of took that desire to learn more about the body into, high school and then college. And then eventually I ended up deciding to become a chiropractor.
Wow.
In college. So it was one of those things where, because I had that early love for just doing everything that I wanted to do in terms of getting people better, I just kind of used that to kind of learn more about healthcare, and that became my driving force to really try to figure out not just how are people currently treating the body, but how does the body work? Because before we put something in it, and this is one thing I'll tell your audience, it's always good to get understanding, and all that get understanding. So don't just say, hey, I've got this problem, I've got that problem, let me take this, let me take that. How is it supposed to be working is the first question, right? And if my spine is supposed to work where when I stand up, it should be supported. When I sit down, I should not have pain. When I'm sleeping, I should not have pain. Now it's having pain when I'm doing just these simple things that the body's designed to do. So, where is it going wrong? And what can I do naturally to get it back to functioning naturally? So I really wanted to learn how the body works from the inside out. And that's kind of what led us to where we are today.
All right. You said you were already in college when you decided you wanted to learn about chiropractic care.
Yes, I was already in college. And in fact, I've never been to a chiropractor. So we were talking about some other chiropractic families. Yeah, we were talking about, when I went to chiropractic school, it's only then when I realized people were getting adjusted for generations. I had friends where they were adjusted since they were babies, and since their mom was pregnant, and I knew nothing about that. To me, a chiropractor was something that either people that were either very rich or very hurt went to. It was no, we got to have a family chiropractor. There was no thought of that. It was more of either I got into a real bad car accident and I'm in severe pain, or that was it, really. So it wasn't until I started learning, and what drew me to chiropractic was that it aligned with where I was. Remember, I told you I liked how the body worked.
Right.
I really didn't like medicine. And I had, at that time, so much patience in my family. The CEOs or the clinic directors of, pediatrician, psychiatry, nursing. My mom worked in healthcare. I had so many people that worked in healthcare on both sides of my family that I kind of, I saw it, but I just didn't want to, work with giving people the same stuff that I never liked taking myself. So the more I looked up chiropractic and the more I looked up that, hey, wait a minute, this is really working with the body. It's working from the spine, which is where most of the information throughout the body, it's flowing throughout the spine. It is the third most important organ of the body outside of the brain and the heart. And all of the information for us to function, for us to talk, for us to breathe, for us to get up and move around, it's going in, passing through the spine. Information is coming in through the spine, and then information is going out through the vertebral column. So that's why chiropractors focus so much on the spine. Now, we also adjust extremities and shoulders and knees and all of that. But even Hippocrates, who is known as the father of modern medicine, he said, look well to the spine first for the cause, because in it there might be the cause of most of the diseases and infirmities that happen in the body.
Well, I was going to say, don't all the nerves really come off the spine as well?
All the nerves come outside of your cranial nerves. And all of the nerves are going to have to pass. They have to pass through that main highway. So, and the University of Colorado, they had a study that showed that your nerve root, which is like that little bubble, if you look at the spine, it's almost like the little bubble of the nerve, and then the nerve goes out into the fingers, into the toes, into the GI tract. But that little bubble, or aka the nerve root, that comes right off of the spine, the weight of a dime can decrease or increase the output of that nerve by up to about 60%. Wow. So you can shift how much information is going to or coming from the body just by alleviating pressure that close to the spine. And we're just talking about one segment. Yeah. So when I'm looking at MRIs today and people have multiple disc People have multiple disc injuries and bulges, or they've got muscle spasms that's locking up a whole area. You can see how that would affect their arm or the rest of the body or their GI tract and all the other non-musculoskeletal conditions that they have as well. Yeah.
All right, I have a two-part question for you here.
Yeah.
Because I didn't realize this about your family, your parents growing up. So two-part question. What lessons actually stuck with you that from being growing up in the household and then also going to school to become a chiropractor that you didn't realize mattered until later?
What lessons stuck? You know what? For one, I think that I learned very early on the body heals itself and the body's a self-healing organism. That is something that even though in healthcare, it's known as a fact, but it's not used in how they treat the body.
Right.
Because the minute that somebody has something and you go somewhere, a lot of times they're trying to steer the body away from what it's naturally designed to do. So that was one lesson that I learned. Another one I would say is really just doing your best at everything that you can. And to me, I think that later on, I think it was until much, much later on, I realized, I want to say it was more from the business standpoint. Like I said, my parents were business owners.
Right.
And there was a lot that happened. I realized that it took a lot of hard work to really not just have your name on the door. I think we were talking about that earlier with podcasting and all of that. But I think they showed me, the value of, when you are a business owner, you're not just in business for yourself. You're in business with the community,
Oh.
And I used to, and actually, that's funny that you asked that question. You must, this is not your first interview. Because, the reason why I say that is because I actually used to be angry with my parents because they worked so much. And I also used to be angry that, like I said, there was 5 different offices. My father was actually always on the radio, on WLIB, on 107.5. He would always be hosting community events and all of that stuff. And I didn't realize that him being a business owner meant that he was sharing himself with the community. Right. And I think that I've realized that now. And even with my kids, I try to bring them along and I try to show them like, hey, if I'm missing or if I'm gone for most of the time, I want you to come out to one of this philanthropic event that we're doing, or we're working with this organization, or donating over here, or even with doing things with my fraternity and all of that. I think that the family now knows that our business, wherever we have a location, we're not just there so that we can, take from that area, right? Just billing co-pays or whatever. We're there to be a part of that community, and we're there to be an integral part of how we get that community better as a whole, right? And I think that's where, from my bachelor's, which was more like ex-phys and learning about the body and learning more singular, like how the body works, my master's was in public health, because my master's was more, hey, well, now that I know how to get rich better, now if everybody that works where Rich is working, or everybody that does podcasting is having lower back pain, or everybody in this neighborhood, or if everybody in this sub segment of the population is dealing with the same issues, what can I do from a public health program to get them better as a whole? Because obviously the trends are moving in a negative light. Like more and more people are having surgeries. More and more people are getting knee replacements early on. More and more people are being sent to, pain management and things of that nature, and having to have a dependency on pain management and pharmacological solutions rather than natural solutions. So and that's what led me to write the book, because I was looking at, after about 15 years of practice, I was looking at the public health trends that everybody was coming in with the same problem. Everybody was already seeing multiple doctors and not getting better. everybody was being told to just, ignore this small symptom that's actually something you need to take care of, or sweep everything under the rug with a quick injection, quick pill, and then things would balloon and get worse later. And so many people would be upset when we would just explain to them the truth about what's going on with their body,
Yeah, you're just masking the pain. I mean,
Exactly.
you can't do that.
Yeah. Because sooner or later it's going to show up. And a lot of times,
Yes.
and this is what I tell a lot of patients, your pain never makes an appointment to show up. It's going to show up right in the middle of your podcast, right, Rich? It's going to show up in the middle of, you're getting the kids to school, you're going to work, it's about, you got one more big day and then you're getting that bonus or whatever it is. It's going to show up right when you least expect it. And now it's going to force you to deal with it when it was just giving you warning signs early on that we've been taught to ignore from a public health standpoint. The system of healthcare is more of a sick care system. It's more of a, if you're really bad, let's take care of it. But if it's not that bad, take 2 of these, call me in the morning. And that's our natural paradigm that we're in right now. So until healthcare has a paradigm shift where we all realize that we are the best people to take care of ourselves, like we have to be the ones to step up and take care of our own bodies and our own health, and also the health of our families. And that's why I wrote the book for everybody that is in charge of making the healthcare decisions, whether it's buying food on the table or setting up the doctor appointments for their family. That's what I wrote the book for.
Well, and the thing is, too, because I've said this several times, I literally have to be on the brink of tears before I even pop a Motrin.
No.
Yeah, I don't like that. And I think chiropractic, well, I know for a fact that chiropractic care has helped me a lot.
Yeah.
It's helped with my headaches. It's helped with the arthritis.
Yeah.
A lot of people will probably tell me I'm full of it, but no, it's the truth. And I never realized that chiropractic care could take care of so many things.
Yeah. And when you look at the inception of chiropractic, people were going to chiropractors for so many different ailments. And that's why they bumped heads so much with, at the current time, the AMA, the American Medical Association. Yeah. And there was all of this, that was, of course, it was founded to be not true and false, but there was so much, dogma and false information that was put out about chiropractic. Way back, we're talking like 1940s, 1950s, some early chiropractors went to jail, just for practicing chiropractic and getting people better. And the current healthcare establishment at the time said, hey, we're the only ones that can get people better, but people were getting better. Yeah. So, fast forward, you've had a lot of that kind of stick with a lot of the psyche of a lot of the older doctors, like some of the old school doctors. I still might run into it where they'll be very, anti-chiropractic, but a lot of the newer doctors that are learning more about the benefits of integrative healthcare, which is what we practice at the office. Like, we work with medical doctors, we work with surgeons and other healthcare entities because we want to collaborate with them. But our motto is, let's see if we can get them better first naturally. And if we can get them better first naturally, now, by all means, now you should probably be taking something because we don't want this to get out of control. Right. And if that doesn't work, now maybe we need pain management and all the other things. And if that doesn't work, now we need surgery. But there's so many patients that I'm meeting, and it really depends on the doctor that they meet first. So that's why it's very imperative for your audience to hear, like, who you go to first actually determines the outcome of how you end up 3 to 5 years later. There was actually a study, I want to say this was in Washington State. They were looking at workers' comp cases, and they saw that out of all of the people, let's just say if there was 100 people that went to get care for low back pain, all of the ones that went to a surgeon first, within 3 to 5 years, I want to say about, I don't know the exact numbers, but an overwhelming majority of them ended up having surgery within 3 to 5 years. Compared to those that went to a chiropractor, the numbers were dramatically reduced. Oh, yeah. For those. And I want to say it was like, don't quote me on it, but it was upwards of like 70 to 80% of those that
I
went to
believe
a
it.
chiropractor 3 to 5 years later, guess what? They still didn't have surgery. Why? Because we initially told them, hey, listen, let's see what we can do naturally to alleviate this pain, get
Mm-hmm.
you out of pain, and also teach you a better maintenance program, kind of like what you just spoke about, right?
Yeah.
So, like, if you've got low back pain from 30, 40 years of whether you were in the service, just like you were, thank you for your service, or whether you were contract or you were sitting down, clerical, and just sedentary for most of your life. Now you've got a disc bulge at L5, herniated disc at C4, C5. There's not one magic chiropractic adjustment that's just going to make all of that go away, and you don't have to see us again. There's going to be things that you're going to have to do to manage your condition and maintain your condition so that you dial it back from the degenerative process that's already at work in the body. That's why chiropractic helps with arthritis. That's why, as you said, you might go maybe once every 5-6 weeks or something like that, because it makes a difference. It makes a difference.
Oh, big time. And we're going to get into the book, but the other thing I think that made a big difference with me is also I started dropping the weight.
Oh, there you go.
And when you start feeling better because the chiropractic care helped,
yes,
you can do more. And oh my God, I never thought I'd see my toes again, but I can, now I can walk farther and all that. I want to bring up another point too. How long have you been practicing now?
Man, it feels like just yesterday. Thank God. Thank God for my youth, or at least still feeling young. But I started practicing in 2008. So I think I'm going on my 18th year of chiropractic.
All right. So just in that time.
Yeah.
When it comes to chiropractic care, how many different tools have come out to help you as a chiropractor to help people? Because I'm bringing this up because I think this is where one of the biggest misconceptions of people have about chiropractors. They could have gone to a chiropractor 10 years ago, but that chiropractor may not have had the tools that they have today, whether it be a new table or whatever. So just in the time you've been there, what's been some of the biggest improvements you've seen?
Well, you know what? I think that part of the public perception of chiropractic, especially right now, because you've got all of these YouTubers that's out there doing all of these, crazy adjustments, and even people like making fun of it. Like I've seen one where somebody sent me, it was a chiropractor, but they threw somebody from a helicopter. Like it was just so drastic, right? But it was just making fun of how crazy people assume the chiropractic adjustment is. And I think back in the day, there was a wide spectrum of chiropractic. So you had light adjusting or soft tissue adjusting, and then you also had more high velocity or stronger adjustments. And I think those are the ones that maybe it might give some people apprehension.
Right.
But I think throughout time, chiropractic has evolved. So for one, right now, there's about, I would say probably well over 150 techniques, maybe even more, just within chiropractic, just within how to get somebody better. Now, out of all of those, some of it might be more soft tissue based, some of it might be more manipulation based, and then within the school of chiropractic, are we adjusting just one segment, or are we more of like a chiropractic biophysics? Are we looking at the whole region and trying to make sure that the whole region, like the whole cervical area, like the whole neck curve looks better rather than just looking at C5? And that's made a big difference. So what we've done in our office is that we have evolved in a way where, for one, we start everybody off with a light adjusting, just so that, we don't know what they've been introduced to or what they haven't been. So we'll start everybody off, one, with a thorough examination. We want to find out what's going on. We want to see how we can help them, what they've done, what they haven't done. From there, we kind of come up with like a tailored treatment plan so that our office is integrative. So chiropractic is at the cornerstone of what we do, but it's not the only thing that we do. So, and that's another thing. Like there's some chiropractors that are known as straight chiropractors, meaning they're only going to adjust you and they're going to leave you alone.
Yeah.
And in most cases, you'll see where that works because that's all the patient needs. Now, most people that come to us, they are more on the severe side. Like we actually specialize in helping a lot of people that have not been helped by physical therapy, pain management, or other chiropractors. So or we've partnered with other chiropractors where they'll send some of their more complex patients to us. So we actually pride ourselves on that because everybody's got their own technique that they specialize in. And with us, we're used to kind of dealing with those complex patients and patients that haven't had help and using other avenues. So that's why we kind of slow down the exam process, really figure out what's going on, and really tailor the treatment. So we do a good bit of physical therapy in the office as well. But within the chiropractic techniques, there is something called activator. That is a very light force technique. Activator is like a little tool. It almost looks like a little pogo stick. And I can put it right on C5, and it's just going to shift the bone just enough to at least stimulate the nerves that sense what's called your mechanoreceptors or your proprioceptors, and it's really just going to stimulate them enough to at least start to get some motion into the body. So chiropractic has evolved a lot. I know a lot of people still feel like it's the big wrestling moves that people are going to be doing, all the crazy stuff on YouTube. But once somebody walks through their first treatment with us, what they're seeing is that, okay, you know what? They're really just trying to help get my body to mobilize and to move better.
Yes.
And we start them very light, and then we progress as time moves forward. But sometimes just starting them very light, that's enough to at least start the process of the healing. And people are amazed at how much quicker they're feeling better, even after going to all these different areas. It's just a matter of, did we address the disc with spinal disc decompression? Did we minimize the inflammation? With maybe things like cold laser therapy or muscle stem or something like that? Did we bring more oxygen to the area using things like shockwave therapy and or pulse wave? And with us, we have what's called the renewed process. And that renewed process is almost like a protocol on how we get people better. And it's more of a trademark system that we use that I developed over my 18 years. And once we take them through the process, make sure that we're giving them, reducing inflammation, making sure we address the nutrition, making sure that even if we need to incorporate things like stem cells and regenerative medicine, those are things that we do at the office, and we partner with other doctors as well to perform.
Did you say nutrition?
I sure did, sir, because you know why? The healing happens at a cellular level. People have to understand, they can't say, oh man, I'm going to the chiropractor, but I'm still not getting better. But they're saying that on the fast food drive-through, right? And they're saying that, drinking their 8th cup of coffee for the day, or, having the fried foods or the, whatever it is.
Yeah.
Too much sweet. So healing happens at a cellular level, and people have to understand that, we are what we eat. I know that's a cliche saying, but we are what
But it's true.
Yes. And so many times people are in trouble because their body is in a state of inflammation. It's one thing to be out of alignment, but it's another thing to be out of alignment and you're inflamed being out of alignment. So now the structures that, remember, we know how the body works. We know that disc can absorb a lot of pressure, but if the fluid in that disc is almost all gone, we're about 70+% water, right? All throughout the body. So if the disc is almost dehydrated to the point where the disc should act like a natural jelly donut, where water or fluid or blood flow should be able to go naturally inside your disc and outside of your disc if your spine is moving properly. But when that small mechanism is locked, that's where so many people get into trouble. So if we're adjusting you, but we're not addressing and we're not rebuilding or reviving the spinal disc through something like spinal disc decompression, you're only going to get that, 50% improvement, but you still got the restriction here, or you're 50% improvement, but you still got some of that sciatica still going down the leg or anything like that. So we've got to deal with nutrition. We have to at least talk to patients about it. And the patients, especially those that are going through the regenerative medicine program, or our natural medicine program, we make sure that we give them a liquid vitamin nutrition so that their body has all of the ready building blocks to start rebuilding whatever it is that the body needs to rebuild.
Wow. Which is why it's also important for people that are going to a chiropractor to listen and even do the stuff at home that your doctor tells you about. Yeah. And I think that's where a lot of people mess up. And correct me if I'm wrong, but they won't do the exercises or eat properly once they walk out of the office.
Yeah. Yeah. I would say the number one litmus test on how much over my 18 years, and I've seen, and like I said, if you think about it, just like you said, sometimes you have to wait till you're really in pain to get emotion. That's typically most people that's walking into our office, right? They've waited or they've delayed. And for us to have a high success rate with those patients that have already either been neglected or mistreated or misdiagnosed somewhere else, the number one litmus test or number one factor that somebody gets better or not is their compliance, right? Because we've seen a lot of tough cases, Rich, that even I was upfront with them and said, look, if we get 20, 30% improvement, we're doing good. And they actually got better because in their mindset, they were determined to get better. They were determined to get better. And so many people, I think, and I don't know, maybe that's a larger question in healthcare. I feel like because healthcare has just been giving people just whatever, and people have just been so dissatisfied with the system, I almost feel like people don't believe that they can really feel better. Or maybe they feel like they don't deserve to feel as good as they should feel at 65, or they just accept it, right? Because so many times I'm trying to beat up that myth of, it's old, it's age. No, it's not age, because I have 10 other patients your age and they're feeling great, right? So it's not, you can't say it's age. And then you and I spoke about the weight issue. It's not weight, because I can grab 10 other people with your same weight and they don't have that right knee pain. They don't have left sciatica. They don't have a bilateral cervical radiculopathy. So yes, the weight is a factor and it adds to it, but we've got to have the mindset to get better. And that's why when I came up with the title for my book, I had to speak to the mindset. And that's why I said dare to live well, because that dare back when you were a kid, you wouldn't do anything, right? We wouldn't do much. We wouldn't go into the mud patch, or we wouldn't go here. But once somebody said, hey, I dare you to do it, now at least you're thinking about it, because now the pressure is on. And then when they double dog or triple dog, or whatever it is, now you got to do it, right? Or you're getting punked out in the playground. But that's what it was. It was dare to live well, because that there has to be a mindset shift for you. Yep. There has to be a mind, especially now if you're just dealing with a typical sprain that's going to go away on its own. I'm not talking about that. That you can do it. You can, get an adjustment. You can do this. You can do that. Take Motrin, whatever. But for the stuff that's really bad and it's not going away, your mindset is going to have to change, especially if you've been dealing with that for at least a year or more. You're going to have, what's the definition of insanity, right? Doing the same thing, expecting a different result. So your mindset has to change. And that's where that dare comes from. There has to be accountability. There too, it's a number 2. Yes. So the number 2 is because usually I want people to at least, part of the way you change that mindset is, one, having somebody that you want to be an accountability partner. But I think what helps a lot of people get better and pushes them into the right direction is when they're living better for someone. And that someone could be living or past. Like I've had some patients that said, hey, my dad, they're coming to me. Why? Because their parents or their grandparents had 5, 6 surgeries. People have already seen. I think this generation, the reason why there's this apprehension with healthcare and with just taking 2 and calling me in the morning, and that's why that whole patriarchal nature of the healthcare system is kind of faltered, is because people have seen the results of what modern medicine does.
Yes.
People have seen the results and the negative results. I'm not talking about all the great things that happens, but I'm just talking about all of the things that have just been swept under the rug. And people are just asking questions, as they should. Hey, wait a minute. Why did my dad have 5 lower back surgeries? Could he have avoided the first one, which would have avoided that whole domino effect of that I need all these other ones back in, subsequently. So people are just paying attention and they're waking up, but I feel like a lot of people, because YouTube is out there, sometimes if they're not careful, they can just tag on to the wrong information.
Yes.
And not get adequate information. They might get information that says, oh, don't see a chiropractor. They might see one YouTuber that says, oh, I'm not doing well after one adjustment. But that's one case, that's one right, whatever. So you want to make sure you're doing the right research and you want to have respected and trusted sources. So the reason I wrote my book is anybody that knows me knows that I'm an integral person. And I wanted to put the right information out there so that people could know, look, this is what the healthcare industry is. This is what you've got to do. You should have a team of healthcare providers. I feel like a chiropractor or somebody that's naturally minded should be one of those people on your team. Just like you're putting
absolutely.
If you're putting a football, a soccer, a basketball, a baseball team together, you're going to draft, you're going to get people with different skills. Because you want to win the championship. So I call it your healthcare dream team. Every one of your listeners should start developing your healthcare dream team.
I love that.
I have a primary care that I can trust. Okay, check. Family has a history of heart disease. So I've got a cardiologist that I'm seeing. Okay, check. My dad had 5 back surgeries. Okay, I've got a chiropractor, trusted the family seeing, check. And then you build that healthcare team based on the assessment that's also in the book, based on all the things that you got, whether it's mental health. Do you need a mental health professional on your team? Do you need whatever it is, internist, rheumatologist, whatever it is, the sooner you can build that team and start getting checked early so we can start preventing getting the colonoscopy, getting the prostate scan, getting the, heart checked, right? EKG, all of that stuff. The more you build that team and you start doing it early, now we start living well, which is optimal.
And longer.
And I was just about to say, what's well? Optimal function for a longer period of time. Everybody's living longer. We know that. What's the quality of life that you want to live? Because we know that we're living longer now, right, Rich? So people are not dying off at 60, 68 like they were 50, 60 years ago. Now we're living to our 90s and hundreds, right? Due to the advancements of healthcare, which is great. But what's the condition? I'm meeting people in their 30s and 40s that, their discs are like more than 50% gone because they played peewee football or they did gymnastics or they did rigorous competition at an early age. And now by the time that they're 30 and 40, their disc spaces are very, very thin.
Yeah.
What are they doing to preserve what's left? That's what Dare to Live Well is all about.
I've always said I have a goal. I'm going to make it to at least 100.
There you go, man.
And if I would have been doing this stuff that I was doing before.
Say that again.
If I was doing this stuff I was doing before, I probably wouldn't be here today. In all honesty. Sometimes I'm surprised that I am of all the stupid stuff that I used to do.
I know.
I mean, it's just mind-boggling.
If everybody could talk to their younger selves, like one thing with MSI, we actually partnered with a couple of like the local police stations and Baltimore Police Department. So whenever they're doing a wellness check, because we see so many, we have so many patients that are retirees of, state police, city police, county police, you name it, right? With law enforcement. And so many of them are like, man, if I could have spoken to my 20-year-old when I just got on the force or when I just started wearing the gun belt or I was a young firefighter and I thought I was invincible and I was in the gym, everybody in their 40s, 50s, 60s, they wish they could have that conversation. That's the conversation that I try to have in the book with them so that they know, look, you're not going to live this way forever. And because you're living longer, you have to start making the decisions now. You got to start making it now.
And that's something that a lot of people don't even think about. You look at the first responders and military.
Yeah.
We are always carrying so much weight on our bodies.
Yeah.
That whether it be flak jackets, the gun belts, look at firefighter. I mean, that stuff's heavy.
Yeah,
It takes a
it
toll on
is.
your body.
It is.
You're listening to Conversations with Rich Bennett. We'll be right back. I've got to share something with you. If you're in Maryland and thinking about real estate, you've got to check out Daniel McGee and the Victory Team. A close friend of mine sold their house with them, and honestly, I was blown away by the smoothness of the process and the level of care they received. And it's not just them. Several others in my circle have had similar experiences. Daniel and his team have this personal touch that's just so rare these days. They actually listen and tailor their services to fit exactly what you need. And with fees way lower than the industry standard, you really feel like you're getting luxury service without that hefty price tag. So whether you're buying or selling, go to victoryteamsells.com and get started with Daniel McGee and his incredible team. Believe me, with them, it's not just a transaction, it's a relationship.
Listen, I'll tell you right now. In the book, I want to say it's probably chapter 7, probably chapter 6 or chapter 7. I said everybody needs a chiropractor.
Yeah.
And first, I just kind of go into what it is, what is a subluxation, why there's so much of a difference in the school of thought with chiropractors. So at least they kind of get from a top-down view of what is a chiropractor, and then they could understand going in, okay, I went into this office, this is more of an integrative office. Oh, I went into this office, this is more of a straight chiropractor. And at least they know, and I'm not saying this one is more right than the other. That's more the internal fight within the chiropractic profession. We'll figure that out as we kind of build what the chiropractic identity looks like moving forward. Like you have some chiropractors that want the prescription rights to prescribe, Motrin or this and that. And then others are saying, oh, that's a slippery slope. Once we start doing anything with the pharmaceutical industry, they're just going to kick the door wide open and we won't have our identity anymore. So that's the internal fight. But I don't want the public to kind of worry about that. I just want them to know you might see this one or you might see that one, depending on what's going on. But I said that there was at least 7 groups within the population that need to see a chiropractor yesterday, because of the advancements of where everything is and because of the benefits of chiropractic care and the benefits of how much better they can be living their lives. Number one were people who were involved in any auto accident, and that was one of them. Another one is pregnant moms and also young babies. People don't realize some of the first subluxations happen through that birthing process. So many pregnant women, young moms that are out there, or young women that are pregnant, here's the thing. In healthcare, we already know they're going to be in pain. We already know the biomechanics of their body is going to change. Some of them might have already had some disc issues or some muscular issues or anything, or misalignment issues that were happening before the pregnancy. Now you're adding 30, 40, some cases, almost even 50 extra pounds of weight and shifting the spine around. So they absolutely, I feel like once a young woman knows that they're pregnant, we should start looking for a good chiropractor to help co-manage them and work with their OBGYN or the midwife, whoever they're working with. But that's one of the groups that is in my book that I'm saying these are people in the population where it should not even be a question. Okay? So we've got auto accidents, we've got young adults, young athletes. People don't realize that when you're cheering your kid on and they're doing the Pee Wee football or high school football or soccer, all of the gymnastics. And that's such when I talk to some of my patients that are the teenagers, they're practicing for 2-3 hours a day. And then they're going out and they're playing the whole weekend. And you mean to tell me that they're just supposed to do that and just walk it off and sleep it off? Get your kids adjusted. Like, you're adding so much extra stress and trauma to their spines that they're not going to see until should they make it into the big leagues or, I know it's a small percentage, but should they make it now, they're in their late 20s, early 30s, and they're dealing with all these disc issues and misalignment issues that could have been addressed if they were seeing a chiropractor earlier.
And I'd like to add another one to that.
Oh, yeah, I've got more.
Dance.
Oh, yeah, dance. Yep. Dance is so rigorous. In fact, most of the young ladies that come in, if I have a new patient and they're in their, let's say, young lady, I would say maybe mid-20s, and they've got either like severe neck and lower back pain, I already know I'm going, and this is that public health that I was telling you about, right? I already know that they're going to be in that population that either did gymnastics or dance, right? And yeah, and that is it. If I maybe throw in like lacrosse and field hockey, maybe is another one, yeah. But those two, it puts in a lot. It puts a lot of stress on them. So the young adults, the athletes, the elderly, of course, due to the arthritis, there's so much benefits of just keeping motion into the joints that slows down the rate of inflammation in the arthritis. That's why once you're over 65, you should have it shouldn't even be a question of, yeah, I'm thinking about seeing a chiropractor. You should have one. Now, having one with the right technique so that you're going in and, of course, you're feeling better at the end. That's what doing your research and all of that is about. And then after that, what else was it? I want to say, two more. People with scoliosis, right?
Oh, yeah.
As soon as you know that there's some scoliosis, you should be getting managed just throughout your care. You should be on some maintenance program. Why? Because the pressure is building up in your spine on what's called the apex of your curve. That is the most rigorous part of the bend. And I have some patients, we're catching them early, even in their teens, and they're at 20, 30 degrees of a curve when you should have no curve in your spine. So what are we doing to at least offset that? The traditional medical models, just put them in a brace, maybe give them some PT exercises. But chiropractic is a great add-on, and it's a great complement to just making sure that we're doing the best, right?
Yeah.
That's all we can do is just do the best for them. And I know everybody wants the best for their kids. The last one, I would say active or retired military. When I hear the stories of jumping out of planes and getting up at 4 or 5 a.m. with full gear and marching and all of this stuff, that's the other, if I see a younger person, male or female, and they've got an L5 that's pretty much squished, and I'm just like, man, this person's so young. When I go into the history, I did five years in Marines, Navy, Army, you name it, right? But it adds up. Like what I always try to tell people is we're not invincible.
No.
We're not invincible. We're not robots. I don't care how you feel right now. I don't care if you are a young bodybuilder and you're throwing up weight and you're competing, or if you're, military or whatever it is, or if you're doing gymnastics or dance and you're doing it, sooner or later, it's going to catch up with you. So it's not a matter of if it catches up, it's a when.
It will.
So get ahead of it. Dare to live well now. Build a healthcare team. And if you were one of those people that I mentioned, you will thank me later if you find yourself a good chiropractor.
One of the things, one that you mentioned, and it surprises me, the amount of people that have it and don't go see a chiropractor, is scoliosis.
I know.
That's to me, that should be automatic.
It should be automatic. And you know what's crazy? I've had some patients that said, they went to a chiropractor, but because their scoliosis was, at a certain degree, that the chiropractor didn't want to work with them or sent them somewhere else. With us, we are, like I said, we're used to dealing with a lot of the complex cases, but that's where the examination comes in. You don't want to just, and I think maybe even some healthcare professionals, they might be under the interpretation that somebody's not going to be properly evaluated first before they are treated. And for some offices, that might be the case. Like
right.
I've had people tell me, as soon as I went in, like everybody that finishes our first appointment, one of the first things out of their mouth, I'm not even asking them, they're telling us this was different. This was very thorough. This is the most analysis that I've had by far. Why? Because we're just looking at the body from multiple different angles. Are we getting images? Are we testing bilateral weight pressure? Are we doing the proper orthopedic test, muscle test, range of motion? Are we checking the nerves? Are we? So there's just so much stuff that we do on that first exam. And that really sets us apart. And that, like I said, that's part of that renewed process, but that really sets us apart from a lot of the other offices that are out there. Physical therapy, chiropractic, even pain management or doctors. Most of the times when patients go to other doctors, they'll get evaluated, but they won't even get touched by the doctor.
Yeah.
So, and they'll say, man, well, this is my fourth facility that I went to for this treatment, but you're actually the first doctor that's actually touching me on the exam. Think about that, Rich. Like, how do you know what something feels like? So you mean to tell me they're just listening, taking their word for it, and then just prescribing them a muscle relaxer or whatever? So, it really pays to just slow it down in the beginning. Let's find out what's wrong. And then from there, let's come up with the best tailored, not cookie cutter, but tailored treatment plan. Not everybody that comes to the office needs decompression.
Yeah.
Not everybody needs cold laser or shockwave. Not everybody needs stem cell or regenerative medicine. But for the people that do, let's have that conversation. And then we go from there.
So with the book, because it came out, April of 24?
It came out June of 2025.
Okay.
Yeah. It came out, actually, you know what? Yeah, it came out in 2025.
Okay.
Yeah.
So with it, because I believe every family should have it. It's a guide.
Yes.
It should be
for families.
But is there any particular type of business that you think this book should be in? And here's my thinking. I'm thinking, God, military first of all.
Yeah.
When they get out, they should be given like a care package or whatever. But it'd be nice if this book was in there as well,
sir. If you could take me to the higher ups of the chain of command, I would love to work out a deal with the military. Yeah, I would love that, because it really just gives people an introduction into where healthcare is now, but also what it could be like. I think this book should be in other doctors' offices, because it really talks about how people should be treated at the doctor. What are some questions that they should be asking their doctor? And then also, what does a typical visit to any doctor's office look like? I feel like, and I haven't gotten a chance to do this yet, but I'd love to partner with other chiropractors to get this book if they don't have their own book. Why? Because it speaks so highly about what they do as a profession, and it just talks so highly about how important it is for that patient to be in that office. So every chiropractor, but also all allied health professionals. So that's acupuncturists, massage therapists. They should have the book. And then also, even from a corporate wellness standpoint, I thought before I went into chiropractic, I thought I was going to go into corporate wellness. That was I used to work for Pfizer, actually, in their corporate headquarters, and they had a gym within their corporate headquarters. And why did they have that? Because the companies were seeing, this is maybe like late 90s, early 2000s, that if they invest for every dollar that they invest in their employee getting better, they see it in the productivity, and also in their ROI with the production, with the patient actually showing up and not calling out of work and not calling out. So some of the major corporations and businesses that are out in the county, or even something like Jones Junction, like all the mechanics and all of the guys that are there, they should be getting, so just things like that is what, that's the next phase of what I'm doing. And I'm glad you got me thinking like that, because it's more now, instead of talking about it singularly, because the book is available, Dare to Live Well, the ultimate guide to building generational health. We didn't even talk about that, but the ultimate guide to building generational health, it's available on Amazon. It's also available on Barnes and Nobles, and people can also get it at daretolivewell.com.
Generational health. What exactly is that?
So generational health is the concept of, and that's looking at it from a public health standpoint, but it's a concept of building healthy habits that last beyond your generation. So notice you started, a lot of people, when I when I see the people that are coming in and that are actually more compliant, not as severe, and coming in more preventatively, when I look at that population, one thing I see that they have in common is that their parents were coming to a chiropractor, right? So the same way that you can pass down negative behavior, because when you look at things like alcoholism, when you look at things like drug abuse or things like that, or even with the surgeries, with people that have multiple surgeries, when you look at it from a public health standpoint, you're going to see that there's a family history of it. And because nobody was able to dare to do something different, it kept going down into the family. So what I'm trying to tell people to do is that your healthcare is bigger than you. The decision that you're making is not just to get you better, but it's to get not just the people that it's in your family and beyond, but when you start living healthier, Rich, all the people around you, whether it's a significant other, whether it's your colleagues, if they call you and you're like, oh yeah, I'm taking a nice walk. What are you taking a walk for? I'm just getting that physical activity in 30 minutes a day. Well, maybe I should come with you sometime. All right, well, meet me here. I'm at the track, right? And it's like, it's contagious. So
I love that.
The same way how, if God forbid we were doing negative habits, right? And you were drinking, God forbid, from morning to sundown, God forbid we were doing that, we could easily influence other people to do the same thing because we're coping with all of the stress in life and people are stressed out and they're like, oh, well, Uncle so-and-so is doing that. Well, that's what I'm going to do to cope with my stress. So the same way we could pass down negative habits, we should be determined to pass down positive, healthy habits. That's what generational.
I love that.
Yeah.
So pass on the good hereditary things.
Pass down the good, healthy
I love
habits,
that.
right?
I love
and
that.
Be intentional about it. Because guess what, Rich? I guarantee you, Rich, especially when you have this platform, people are watching you. People are watching. Whether they say they are or not, and whether they are younger, same age, doesn't matter. People are watching.
Oh, yeah.
So with that in mind, be the best. Remember, I told you that value that I learned when I was younger. Whatever you do, be the best at it, right? Because sometimes you only get one shot. We only got one body.
Yeah.
Until we, depending on your faith, we get a glorified body, or if somebody thinks you're getting reincarnated, whatever it is. But right now on this earth, as we're living and breathing
here
right
and
now, we've got one L5.
Yep.
We've got one C4, one C5. We've got one spine, one vertebrae. So how are we treating it? How long is that going to last? And what are we doing to impact the lives of other people? That's where that building generational health is all about. And the reason why I did this, Rich, was because, remember I told you my first chiropractic adjustment I was like 24, 25. And then I said, you know what? I think I could do this, right? So I ended up becoming a chiropractor. But what I did was I saw people coming, and they were coming with their kids, and their kids were watching them get adjusted, but their kids must have been like 4 or 5 years old. And what I would tell every kid was, man, you know what? You're so lucky. I was like, I never saw a chiropractic adjustment until I was maybe, I never saw a chiropractic adjustment till I actually got one. And it was after I was thinking about becoming a chiropractor. So I was maybe like 24, 25 years old.
Wow.
So I always tell those young 4 or 5 year olds, I'm like, you're so ahead of the curve. Just do what mom and dad is doing, right? Do what mom and dad is doing. Yeah.
And I want to add something to that too. For those of you listening, especially adults, do not try this at home.
Yeah.
I think that's one of the places I really screwed up. I would always have the kids walk on my back.
No. I would call that the George Jefferson. I don't know if you remember George Jefferson when he had I forgot his neighbor he walked on his neighbor's back. Right? If people are old enough to remember that, do not do this at home. And why? Like, there's a reason why chiropractors. It's funny because people, like you said, people are nervous about seeing chiropractors, but once they see that we've had to do, at least close to 4 years of schooling and clinical work and all of that, there's a reason for that. Now, it's the safest thing that you can do in healthcare. How do we know that? Look at the third party industries. Look at what a chiropractor pays for help for malpractice insurance, and then look at what a typical medical doctor pays for a malpractice. And that's just a regular doctor. I'm not even talking about a surgeon. Just a regular doctor that's prescribing. They are the best. They are the best industry at assessing risk, right? So if I'm paying, I don't know, maybe $1,500 for the year, and others are paying thousands more, like there's way more risk with you taking a medication than it is to get adjusted. Way more risk. I don't care what they try to say or try to put out there or whatever. There's way more risk doing anything else outside of chiropractic. Chiropractic is one of the safest things that you can do. Yeah. That's what I tell my pregnant patients. That's what I tell the elderly patients. That's what I tell if we're talking to patients. Like we have a couple of babies who were just not, they weren't having proper digestion, and they weren't having proper bowel movements. Brought them to the chiropractor. Guess what? On the 5th visit, kids are going. We've had other babies come in, maybe just not responsive, not, just something was off with the baby, or maybe croup coughing or torticollis. So many different reasons why we see young babies and young kids. Yeah. And they come, and guess what? Naturally, we got their body to function better. Right? Wow. So it's the safest thing that you can do, hands down, in healthcare. It is at the top of the safest thing that you can do, anything in healthcare. Everything else, compare the insurance rates, compare the malpractice rates, and you'll see which one is safer.
So those of you listening, that means when you finish listening to this episode, actually, you should already have the paper and pen out. And at the top of the thing where you write down your healthcare dream team.
Yep.
Number 1, chiropractor. And if you don't have one, don't worry. That was not Dr. Rochelin cracking somebody.
That was me dropping my book.
The book, it's also in audio form, which I love.
Yes, it is. I forgot to mention that. It's actually, so this is the title. That's me.
Dare to Live Well.
My same signature smile, right? So Dare to Live Well, the ultimate guide to building generational health. It is available on Audible as well. How do I forget this?
Did you do the audio?
No, actually, it was somebody, because I have such a unique voice. People always like, did you do the audio?
I wish you would have.
Actually, somebody that sounds very similar to me.
Okay.
But I was just so busy. I would still be doing the audio right now. I had to get it done, but we picked a great narrator, and it's a great audiobook. It is a great audiobook. So it is on Audible, on Barnes and Nobles, and Amazon as well.
Those of you listening, once you get the book, after you read it, make sure you leave a full review.
Awesome.
And then purchase copies for other people, because like I said, I believe every family should definitely have this. Let me rephrase that. Every single household and apartment should have this.
There you go.
Because like my son doesn't live with me now, but I believe that, he should have this. Yeah. So are you working on the next book yet?
You know what? Right now, no.
Okay.
I never even thought I would be a writer. It wasn't, I know you mentioned that mission trip in Haiti. It wasn't until I used to not like reading at all. And because I didn't like reading, I didn't think I was a writer. But I did that mission trip. I did it with my church. It was after the earthquake in Haiti in about 2010. My wife gave me a Mead notebook and said, hey, just journal. And I laughed at her. I was like, journal? I was like, first of all, I don't journal. 2, get out of here. I'm going to be busy, building tents and homes and all. But it was such an amazing, spiritual journey. It was such an amazing just to see how the people live there. They have nothing, but yet they talk to you like they have everything, Yeah. Like we have so much to learn here about when we go down there and we see how people are truly happy with what they have. Right? Yeah. And they're still offering you something. They're still, you come into the house and, hey, what can I make you? What can I give you? And you know that all they have is just so little. The mindset there is just so different. And it's such a strong, so I was so happy and so proud to go down there. But I filled up that book from cover to cover. And I haven't even published that. I always thought about just publishing that and putting that as like a memoir of or something like that. So that maybe might be a to be continued, because it was such an amazing. It might be more of like a Christian book as well too, but there was just so much that happened
Right.
out there. But I'm starting to get ideas for a second book. Right now, we're busy just working with. We have within the past year, we've been helping more and more people with a new service center to help other people that we weren't able to help before. So we've been helping people with neuropathies. Neuropathies are basically when your nerves are degenerating from the outside in. So you start to get pain, numbness, tingling, burning in the hands or in the feet or in both. It's predominantly diabetic patients, but we're starting to see, and that's what I just had a conversation with a podiatrist on, with my wellness webinar that I've been doing. We're starting to see that some people are actually, when you start to screen for early neuropathies, you're actually starting to see that people are having balance issues and temperature differences that are happening early before the diabetes diagnosis and before they get diagnosed with neuropathies. And anybody with neuropathy can tell you it's something that you don't want. The end result of it getting really bad, it's not surgery, it's amputation. So we've really been trying to, we've developed a renewed neuropathy program, the same way that we had success with our musculoskeletal condition. We developed a 3-step process of really thorough examination, figure out what's the amount of sensory loss, because it's something that whatever treatment that we're going to do, it's going to be over a long term. It's not going to be like, hey, I've got neck pain, and within 2 to 3 weeks, we should see this starting to turn around. With neuropathy, it's more of a slow renewal process, because our bodies, they have the ability to renew themselves, and the nerves, they can rebuild themselves, but they do so at 1 millimeter per day. So what can we do based on the assessment, based on the evaluation? What can we do to really help people? One, find out how bad it is. Two, can we tailor some things for them to do at home, nutrition, and then also things that they can do in the office to help stimulating the nerve, something called neuroplasticity. That's basically use it or lose it. If you're stimulating a nerve, if you took out a nerve and you put it in a petri dish, the more you stimulate that nerve, the more that nerve is going to respond. But if you don't stimulate that nerve, now you start to see it die off and die off. So that's what we're trying to do to really rebuild the nerve pathways, so that people can at least start to see improvements and even reversals in some of the neuropathies that we've been finding. We've been getting some great results as well.
Wow.
So I've been putting more of my time and energy in that, and just making sure that we are taking care of patients. But I think my next book, it might be more condition focused. It might be on neuropathy. It might be on just maybe the healthcare industry in general. But sky's the limit, Rich. Sky's the limit.
Oh, I know. Once you become an entrepreneur, I mean, it just means you have to come on again to push that one.
Yeah, exactly.
And actually, I have some ideas for something else, which I'll tell you when we're done here.
Awesome.
But something important, tell everybody the websites for the practice and the Dare to Live. Dare to Live Well.
Dare to Live Well. So the Dare to Live Well, website is daretolivewell.com.
The number 2.
The number 2. daretolivewell.com. That's the number 2. There you can order it. If you wanted to order some merch, we got some merch. Rich, I'll try to send you some merch. So maybe you can do a podcast and maybe like a hat or a T-shirt.
Hey, I'm always happy to wear stuff.
Hey, there you go. I love it. So that's for the book.
I dare you.
You know what? Now I got to do it. Hey, you see how effective that is? You see? I use my own medicine against me. So if anybody's interested in learning more about what we do at MSI, or if it's a complex case, you're not getting help, you've been here, you've been there, part of that renewed process is all the way at the end, the D stands for don't give up. So that's one thing I want to admonish a lot of because there's so many people that have lost hope in healthcare because they haven't found either the right person or they haven't found the right treatment or both. And it's very frustrating, man. If you could imagine, people are already paying an arm and a leg for healthcare.
Yeah.
They're getting the bare minimum and they're getting the runaround. They're being chopped up as if it's like a factory and they got to go to a shoulder doctor here. They got to go to a foot doctor here. Now they're going to physical therapy over here. So we look at the whole body and we really try to comprehensively get them better as best as we can. So for anybody who wants more information, our website is www.msiwc.com. That is Mary Sam Isaac WC.com. We used to be the Maryland Spine Institute.
Yes.
And you still might see that or some of your older listeners still remember we were the Maryland Spine Institute right there outside of the Gold's Gym where it used to be. Now we just moved right up the street to the Winners Run Professional Plaza. We're right outside of Mucho Gusto, right across the street from Winners Run Apartments, or right up the road from Jones Junction. We're one light up from Jones Junction, since everybody knows where that is. And we take great care of people. And we just need them to dare them to take the first step. So the phone number is 410-877-8077. We've got 2 great locations. One is right there in Harford County. The other one is right off of that Bel Air Road exit on 695, right the Bel Air Beltway Plaza.
Yeah.
Movie theater used to be there, but Overly Physicians is there. The Carrabba's is there. And it's a plaza right off of the exit when you're on Bel Air Road. So just south of Perry Hall, right in Overly, Nottingham, going into Fullerton area.
Okay.
So yeah, we've got 2 great locations. We'd love to help anybody. If they don't get a smiling face or a warm phone call, you tell them to call me, right? And because we love seeing new people and we love helping people. That's our pride and joy. And we try to build a team of people that share that same value as well, man. So yeah, listen, we're looking forward to anybody that we can help and that you send our way. Thank you so much for this time, man. I really did appreciate it.
Oh, I got one more question for you.
Oh,
but you're going to have to pick the question. So first of all, pick a number between 1 and 5.
Oh man, this guy? 4 has always been my lucky number.
4.
I've been the 4th child. 4 is always, I've never been wrong with 4. So give me question number 4.
Oh, it's not question number 4. It's block number 4. Now you got to pick a question between numbers 61 and 80.
This guy. 61 and 80.
Uh-huh.
Let's do question number 80, since 80 has 2 4s. Go ahead, give me question number 80.
Oh, damn. Okay.
What?
No, this is a good question.
Okay.
If I'm going back to your college days.
This guy. Oh man. Now. Okay, let's skip question number 80, okay?
No, it's just a good. No, this is
I
good.
have been redeemed. Before I answer this question, I have been redeemed. Okay? Go ahead, give me question.
I think you would like this. If you could design a perfect educational system, what would be its core principles?
If I could design a perfect educational system, what would be its core principles? Sheesh. The core principles, educational system, the core principles would be, I would say, I would probably have it be the core principles and the core values of MSI. One of them is built on integrity. We want to, I don't care what you learn, or I don't care who you've learned it from. We want to treat people with respect, and we want to have, we don't want to, create something where we're just taking advantage of people, right? And I think a lot of people feel like that's where they are in healthcare. So we build it with integrity to make sure that they have, no matter what the student learns, it's with integrity. Number 2 is we've got, I would say, productivity. Productivity is basically making the best of your time. So no matter what you've learned, how can you create a time block where you are the most efficient, right? I would want to make sure that we put faith in there as well, because you got to have a North Star somewhere. in there. And I'm a man of faith. I don't know for your listeners, I'm actually a local pastor in my church as well.
Oh, wow.
So, and I would probably say ever since college, I was a campus minister, and I taught men's Bible study. I sang praise and worship, which is where my voice got a little raspy and stuff too. So I mean, I did it all. But I would want them to have some foundational faith principles. And plus, I'm an old Catholic school boy from grades 1 through 8. You know, then I feel like that really helped to kind of shape me. So I would have some faith in there. And then, man, let's see. And then I would want it to be comprehensive. So many times I think, and this is where I feel like why people are dealing with the problems that they are dealing with is because when they go right now, healthcare has been chopped up to basically your body has been chopped up into all these different parts. And there's been this like over specialization of healthcare, which means, the general practitioner is almost like a thing of the past. Everybody you're going to is a specialist. So I would want to make sure that there is a respect for all of the many different disciplines to make sure that people know if they're learning. And I'm thinking more of like a educational system in healthcare. So it would be more of an integrative approach, which means we're going to learn about the best aspects of everything so that whoever comes, and you can still specialize in it, but at least you'll understand and you'll know about all of the best aspects of all of the different things that can help people so that you can have so many tools under your tool belt, and medicine does not have to be the first answer to everything that somebody comes in with, right? Because that person may not want to take a pill. And what else can you offer them? For many other doctors, that's all that they've learned. And it's not that they're wrong, it's just that it's all that they've learned. So if they had so many other things in their tool belts, now they would say, hey, well, there's chiropractic, there's massage, there's acupuncture, there's so many other things that you can do. There's nutrition and all of that stuff to deal with said problem. Let's try other approaches. So it'd be more of a comprehensive approach. And then lastly, you know what? It's one of the core principles in our office too. It's have fun.
Yes.
Be a fun guy. Learning should not be boring.
No.
How can we incorporate it with something that you enjoy, right? If people come to any one of our offices, there's music playing, it's upbeat atmosphere. We're getting better, but we're laughing and smiling while we're doing it, right? And people say, oh, well, I can't stand doctor's offices. I say, well, you know what? Me neither. I say, me neither. That's why we're going to play music here. And that's why we're going to have fun when we're coming here. Right?
I love
and we're going to get the results. And lastly, I would want to make sure that it's results driven as well. Because no matter what we do, we want to make sure that we are providing results.
Right.
It's one thing to laugh and have fun and to be integral and all of that. But if you came in with sciatica and 30, let's say 30 days or 60 days down the road, you're still dealing with the same problem, the results are not there.
Right.
And that's where healthcare, because right now, if you look at the payments in healthcare, if you look at where healthcare is, everybody's getting paid whether you get the results you want or not. If you go in for surgery and as long as you survive on that surgical table, you know what? The payment's made. You still have the pain. I did the surgery. Go see pain management.
Yeah.
And that's it, right? Whereas with the newer system that I would want it to be more results driven, meaning that you're getting what you paid for, right? You're getting what you paid for. At least we came as close as we could, and we tried everything within the wheelhouse that we could to get you better.
See, and here you were worried about the question I was going to ask you.
You said college,
awesome.
Sir. There's two. There's two types of Dr. Rosh that was in college. I went to West Virginia University, for Pete's sake. Okay? There's nothing to do with those mountains out there. All right? So, but I found God. There's only a small segment of the population that remembers, that wasn't Dr. Rosh. That was just Rosh.
That was a great answer, though. I loved it. Dr. Raj, I want to thank you so much, man. The door is open anytime you want to come back on.
Oh, man, appreciate it.
And those of you listening, again, purchase the book, Dare to Live Well, or listen to it on audio form. Make sure you leave a full review, buy copies for other people, and get that team, that dream team together.
That's it.
And matter of fact, and I'm going to, for all you listeners out there, here's what I'm going to do. I did this one other time. I'm going to do this. Those of you listening, the first 5 people that reach out to me and tell me something about this episode that you loved, I'm going to send you a copy of the book. So the first 5 people, I will buy books for you and send them to you. So,
oh, wow, that's awesome.
Whether it be leaving me a voicemail, email, whatever.
That's it.
Raj, thank you so much. Oh, go ahead.
And then since you're doing that, I would say those first 5 people that reach out to you or that reach out to our office, if you are calling and as a result of this podcast, I want you to mention that to whoever picks up the phone. Say, hey, I heard Dr. Herold on the Rich Bennett podcast. And what I'm going to do is what can I do? I'm going to do something, but I can't figure it out, and I don't want to get in trouble with my staff. But I'm going to do something very special for you that is as a thank you for, 1, listening to me and Rich when you could have done anything else, and then 2, just so that we know that you came from this podcast. So I will do something for you. Matter of fact, I'm going to have a merch bag. That's something I can guarantee.
There you go.
You're going to get some merch. All right. And you're going to get a free merch bag. Most patients will get that maybe on their re-exam or whatever, but you're going to get that right on your day 1 because you heard this podcast. So boom.
So there you go. Those of you listening, we both dare you to do what we just said.
That's it. That's it, sir. It's contagious. I told you.
Thank you for listening to Conversations with Rich Bennett. I hope you enjoyed today's episode and learned something from it as I did. If you'd like to hear more conversations like this, be sure to subscribe to the podcast so you never miss an episode. And if you have a moment, I'd love it if you could leave a review. It helps us reach more listeners and share more incredible stories. Don't forget to connect with us on social media or visit our website at conversationswithrichbennett.com for updates, giveaways, and more. Until next time, take care, be kind, and keep the conversations going. You know, it takes a lot to put a podcast together, and my sponsors help out a lot, but I also have some supporters that actually help me when it comes to the editing software, the hosting, and so forth. There's a lot that goes into putting this together. So I want to thank them. And if you can, please visit their websites, visit their businesses, support them however you can. So please visit the following. Full Circle Boards. Nobody does charcuterie like Full Circle Boards. Visit them at fullcircleboards.com. Sincerely Sawyer Photography. Live in the moment. They'll capture it. Visit them at sincerelysawyer.com. The Joppatown Lions Club, serving the community since 1965. Visit them at joppatownlionsclub.org. And don't forget the E at the end of Joppatown because they're extraordinary.